The doctor is in, and today it's pediatrician Dr. Robert Wittrock from Ascension St. John Pediatric and Adolescent Medicine. Today we're talking about penicillin allergies. Dr. Wittrock, thanks for joining us as always.
Yeah, thanks for having me on.
Good to see you. Well, this is a very common diagnosis, but can often be mistakenly made. Is that correct?
Yeah, so interestingly enough, I've got a lot of patients who come in and say, hey, I've got a penicillin allergy, or my kid has a penicillin allergy. What do we do about this? Because sometimes it can really kind of close off what kind of antibiotics we use, and sometimes those antibiotics are more risk of side effects, or they're not as effective and things like that. So the usual case I see is a kid comes in, they get diagnosed with a ear infection, pneumonia, strep, something. I give them amoxicillin or something similar to it, and then after a few days, they get this like hive rash kind of thing, and they seem like they're getting better, but then they get this rash, and family comes in and they're like, oh my gosh, my kid has a penicillin allergy. What do I do about this? Well, first thing I let them know is I say, hey, take lots of pictures of it, because I need to know exactly what it looks like. I think it's a good idea to go ahead and give them an antihistamine at that point too, just in case. And then of course, if they start, wheezing, coughing, having more swelling, then take them into the ER. But if that all looks fine, then I start talking to them about what other things may look like a penicillin allergy. So there's actually a lot of viruses that can kind of cause that kind of rash. Roseola is one of them. Scarlet fever from strep throat's another. Sometimes teenagers who get mono can kind of have this whole body red rash if they get some antibiotics too. They found that about 10% of the U.S. population say that they're penicillin allergic, but they found that 90% of those people are actually not penicillin allergic. So really only like 1% of the population actually has true penicillin allergy. So there's a lot of people out there that are saying that they're penicillin allergic, but they're not really. Most of the diagnoses come whenever they're less than 3 years of age, but yeah, that's kind of important to know.
What does the diagnosis actually look like then, if only 1% really actually has this allergy?
No, that's a good question. So to be able to get the true diagnosis of penicillin allergy, usually they come and see me. We kind of, go through everything, but oftentimes I send them off to an allergist. At the allergist, they may do like an oral challenge. So they may give the kid a dose of penicillin and just watch them for about 30 minutes to an hour or so. Another thing they can do is like a skin prick test or some other things like that they can really truly diagnose the penicillin allergy.
So if parents are worried about that with their kids taking medication and stuff, do you encourage them to just go with it and test it out first?
Yeah, if they're worried about it, because usually I get families that may have a history of penicillin allergy. I say it's usually fine. There's not so much a genetic component to it, so I think it's okay to try, but then I educate them and let them know, hey, but this is what it looks like when you need to be worried, So
when you see that rash, monitor it?
Monitor it, take pictures of it, definitely. A lot of pediatricians' offices, my own included, have a portal system that you can always send us pictures, and that way we can look at it pretty immediately too.
Right on. Well, Dr. Wittrock, thank you so much for being here. As always, we appreciate it very much.